This meeting is being recorded.
Hey, welcome everybody. We're going to be starting here in a moment. I want to welcome you to what we think is going to be a very, very interesting and informative program today. So give us one more minute. We'll let some more people in and we'll get started. Well, why don't we start? Welcome everybody. My name is Dave Myers. I'm the director of the Berks Alliance. We've been hosting these spotlight programs for the last little over a year. They're very interesting things, introducing people to very interesting and important topics in the community. I want to introduce John Weidenhammer, who is chairman of the Berks Alliance, for a brief welcome. John?
Dave, thanks so much. And Dave, thanks for your efforts to organize this presentation today. I do think it's an important message, and I, for one, am looking forward to hearing it. Also, I want to thank our presenters today for the work that they put into preparing and presenting this presentation. Also, I want to thank our audience. We really appreciate you tuning in to these spotlight programs. I want to wish everybody, on behalf of the investors in the Berks Alliance, just want to wish everybody a most joyous, happy, and safe holiday season. So with that, Dave, I'll turn it back to you and we can get on with the presentation.
Great. Let me cover quickly the ground rules we have for these events. We will have a formal presentation being run by the Reading Health Foundation. We'll ask you to use the comment section, the chat function at the bottom of the screen to submit your comments. We will try to get those covered then by the time after the formal presentation. We are recording this. We will share that recording with everybody who registered for the event. We sometimes have people register but not come to the event and watch the video at their own leisure. We also post it on the Berks Alliance website, and we will post it and share it with BCTV. So with that, I want to welcome everybody for what I think is going to be a very, very informative and interesting conversation, a very important topic and a very important relationship to some other things that the Berks Alliance has worked on in terms of people's access to healthcare and what determines whether people have access to healthcare. We have three presenters today.
She pulled the clip art shot off, but the work plan I sent.
Mute while we're presenting, so sorry about that. We have three presenters: Tony Ballister, who is the Director of Development; Courtney Powers, who's the Director of Community Engagement; and Ashley Gallen, who is the coordinator of the Mobile Mammography Program. So welcome to the three of you, and Tony, I'll turn it over to you first.
Thanks so much, Dave, and thanks to John and Dave and the Berks Alliance for having the Reading Hospital Foundation and our Community Wellness Department be able to share about this great, really, community effort that took place over the past 2.5 years. As Dave said, we're excited to have Courtney here, who's our Director of Community Engagement, and as well as Ashley, our Director of the Mobile Mammography Program. And you're going to hear first from Courtney about some of the statistics that led to this project, from the Community Health Needs Assessment. So Courtney will really give you the background on how this program came about. I'll share a little bit about our great support that we got from our community and donors. And then Ashley will share, maybe most importantly to all of you, how you can become a community partner and have the mobile coach on your site, as well as sign up to get your annual breast cancer screening if that's something you need to do. So with that, I'll turn it over to Courtney. And again, thank you so much to John and Dave.
Thank you, John, Dave, and Tony for the great introductions. So as they said, my name is Courtney Powers. I'm the Director of Community Engagement at the hospital. And today I'm going to lead off the program with kind of the why. Why are we here? Why is this project something that is important and is a needed resource in our community? And a lot of that, again, stems from the research of our community health needs assessment and our priority area of increasing access to care in Berks County. Okay, so you can see here on the first slide, here is a picture of our beautiful coach. Hopefully you've seen it out and about in the community. If you haven't, hopefully you will very, very soon. All right, just starting out with some general statistics around breast cancer. So breast cancer is the most commonly diagnosed cancer for women in Pennsylvania, and 1 in 8 women will be diagnosed with breast cancer in their lifetime. So as we're coming up on the holidays, we're going to be spending a lot of time with family, maybe at work events, things like that. You know, as you're sitting around the table, look around. 1 in 8 of the women that you are seated around and near will be diagnosed with breast cancer in their lifetime. So that's a really staggering rate. And it's something to really, you know, hit home and take home with you as you're engaging with the women in your life around the holidays. Also, 85% of breast cancers occur in women who have no family history of breast cancer. So we do know that in some forms of breast cancer, there is a genetic predisposition that could increase your rate of having breast cancer. But as you can see, for the majority of women, there's no family history. There's no genetics being passed down from previous generations that is impacting the odds of them being diagnosed with breast cancer. From our 2022 Community Health Needs Assessment, we can see that breast cancer is the most commonly diagnosed cancer in Berks County at a rate of 124.3 per 100,000 of our population. And that data comes from our Pennsylvania state cancer profiles. Okay. We know that early detection can save lives, and screening mammograms are the first step in addressing, identifying, diagnosing, and addressing breast cancer in women. Many women with breast cancer have no symptoms. Screening mammograms, again, are used to find that disease early before it causes any symptoms, before they're even presenting with any symptoms. And with early detection, breast cancer has a 90% survival rate. So that's why this screening is so important. It can catch cancer before it becomes a major issue, before it becomes a late stage cancer. And if we catch it early, there's treatment plans that can be implemented that can really substantially increase a woman's rate of survival. Healthy People recently announced their 2030 goals, and their target for increasing the proportion of females who get screened for breast cancer is 80.5%. When we look at national, state, and county data, we can see at Berks County at 70.5%, we lag behind both the state and national levels of screening for mammograms. And we're also pretty substantially behind, 10 percentage points behind that 2030 target. So we definitely still have some work to do in this area. When we look at our Tower Health Service area, Reading Hospital lags a bit behind our colleagues in Phoenixville and Pottstown hospitals as well, at that 70.5%, and we see that they are at 73.8% of their patients who are eligible for a screening having completed them in the past 2 years. Right. We know also that there's some racial and ethnic disparities when it comes to breast cancer. Non-Hispanic white women are more likely to be diagnosed with breast cancer than any other racial or ethnic groups. However, Black women are 40% more likely to die of breast cancer than white women or any other ethnic groups. And Hispanic women are often diagnosed at a later stage and generally present with larger tumors than white women. So we can see that there's some racial and ethnic disparities among populations within our community. And our screening mammograms, if we increase the access to these women, will be able to allow them to hopefully decrease mortality rates and catch the tumors and the cancer sooner rather than later. If we look specifically at Reading Hospital data, so this data is from our EPIC electronic medical record, Looking at overall mammography screenings between 2018 and 2020, of those eligible, of all the women who come to Reading Hospital and are eligible, you can see that we're floating around a 50% completion rate. So we see that there are a number of women who fit the eligibility criteria age-wise that are able to get them, but they're not. And there's a number of factors that could potentially create a barrier to them being able to access the screenings. We also, looking at that data a little deeper, see that 5 zip codes, and we see 19606, 19601, 607, 605, and 604. So the areas in and around the city of Reading, approximately 23% of the patients who haven't completed a screening mammogram are from those zip codes. And we know that those populations are especially vulnerable to different barriers to accessing care. As we look at race and ethnic data as well, we can see some additional disparities. So you see the completion rates highlighted red are where we see lower than average, lower than anticipated levels of completion. So we see our friends who are American Indian or Alaskan Native, Black or African American, Native Hawaiian or Pacific Islander, and other are falling below our completion rates as compared to white and Caucasian women or Asian and Asian Indian or other Asian. Same thing when we ethnicity, we see our friends who are Hispanic or Latino their completion rate is at a lower level than those Hispanic or Latino. Right. I know I mentioned barriers to accessing care, and this is what our coach is hoping to do. Our coach is hoping to decrease these barriers, reduce these barriers, eliminate them by bringing these valuable screening mammograms closer to our community who needs them. So we know that transportation, having reliable transportation to get to and from appointments can be a barrier. Inconvenient appointment times. If someone is working 8 to 5 and our imaging centers are only open from 8 to 5, they might not be able to access these screenings as readily as someone else with a different work schedule. Insurance and cost can be a barrier. Health literacy can also be a barrier. Childcare. It's not very convenient to take a young child with you to a screening program where you're there for 10, 15 minutes getting the imaging completed. So lack of access to childcare can cause some barriers. Sick leave or being unable to leave work. For some women, again, those inconvenient appointment times, 8 to 5, I have to leave work for maybe an hour or more to account for travel time, checking in at my appointment, actually completing the screening and getting back to work. If they don't have sick leave or they're not able to readily leave their workplace to have a screening done, that can cause a significant barrier. By bringing the coach to them, to their workplace or to a more convenient location, we hope to reduce that barrier by making it easier and quicker for them to get a screening. Cultural and language barriers can also cause issues with accessing care, and just a general awareness of where and how to access these types of services can cause a barrier as well. All right, so you can see our lovely screening team here. And again, we have this coach to bring these life-saving screenings and make them easier, faster, and more convenient for the women in our community. So just a little bit about the coach and the technology that we have. So we have a digital breast tomosynthesis equipment, also more commonly called a 3D mammogram. So 3D mammograms provide better, earlier detection, and they're FDA approved as superior for women with dense breasts. Because of the way that they do the imaging, there's greater accuracy. So it can find anywhere between 20 to 65% more invasive breast cancers than conventional screening mammograms alone. It also offers peace of mind because of the accuracy. It reduces unnecessary callbacks for false positives. So it takes that stress off of the patient in having to go back for another screening because the accuracy levels are much higher than our traditional screening mammograms. We also have a great clinical team that works with our mobile mammography coach. So we have mammography technologists. They are MQSA qualified and registered to perform mammography. All the results are reviewed by our board certified radiologists who have subspecialty training in mammography, and they're also MQSA certified. And we also have a team of breast care coordinators who are certified in breast care navigation by the National Consortium of Breast Centers, who are able to assist care coordination with patients who might need further testing or might be diagnosed with cancer. And then obviously we have Ashley, who is our program coordinator, who you'll hear from a little later in the presentation, who really leads the charge with coordinating the event schedule for our coach and getting it out into the community. Right. So that is all I have. I'm going to pass it over to Tony, and he's going to talk a little bit more about the foundation and their role in our mobile mammography program.
Thanks, Courtney. Thanks for providing the great background. And as Dr. Barbera said at the ribbon cutting, this was really a community effort. You'll see here on the next two slides the folks that supported this effort. There was over 130 donors that supported this effort. It was individuals, foundations, companies, and we're so thankful for all of them. We couldn't do it without them. Again, as Dr. Barbera said, this really is a community coach. This is something to provide a service to the greater Reading Berks area community to help increase the number of breast cancer screenings and breast cancer education to the women of Berks County. So we're so thankful for all these folks. And I would tell you that some of the great folks that supported this effort are on this call. So thank you directly to you as well. So thankful for that. Next slide, please, Courtney. In an effort to make the community aware of this, we had over a 2.5-year period, we raised just over $2.1 million. We had several salon and community events to bring awareness. There was a group of women that Kate Thornton, our president, put together called the Pink Ladies that were really vital in the fundraising effort and getting out there and bringing awareness and raising dollars for this great fund. The other pictures that you see are of the ribbon cutting. In the center picture, you see Pam Hernandez, who's our director of human resources. You see Deisha Dixon, who is our vice president for diversity, equity, and inclusion. Dr. Ojikudu is one of our great pediatricians at the hospital, and behind her is Dr. Lehman, who is in charge of the ER. And then down below, you see on the left, Kate Thornton, who's the president of the foundation. Again, Deisha Dixon, our VP for D&I, and then Paul Cohn, who is the chair of the board of the foundation. Of course, Sue Parati, our fearless leader, CEO of Tower Health, and then Dr. Chuck Barbera. So again, so thankful to all of our community partners, all the individuals, all the companies, and again, the folks on this call that were supportive of this effort to bring this vital outreach to our community. So at this time, I'll turn it over to Ashley, and she's going to really give you the nuts and bolts of how you can become a community partner and have this bus on your site, and if you're an individual, how you might sign up for a screen. So thank you so much.
Thank you, Tony. As mentioned, I'm Ashley Gallen. I'm the program coordinator for the Mobile Mammography Coach Program. Thanks, Tony, for providing some insight and explaining exactly how big of an impact and help from the community we had to make this program happen. We're so thankful for each and every one of them, and we couldn't be doing what we're doing without them. So thank you so much to each and every one of you for making this happen and getting us out into the community. So we're going to start off by going over our patient eligibility requirements. So are you or a loved one a candidate for a mammogram screening? So the American College of Radiology recommends all women get their first mammogram starting at the age of 40. You can also be seen sooner if you are considered high risk. So something that might make you high risk would be having a first-degree relative, such as mother, sister, grandmother, who was diagnosed with breast cancer. So whatever age they were diagnosed, say they were diagnosed at age 48, you could then start being screened. That individual could start being screened at the age of 38. So 10 years prior to that diagnosed state. So you also cannot be pregnant or breastfeeding. And you cannot have any concerning symptoms such as lumps, discharge, pain, anything like that. So important to note here that we only do regular screening mammograms, annual screening mammograms on the coach. We do not do any diagnostic testing. And then the last piece is it has to be at least 365 days since you've had your last mammogram screening. So if you fall under these categories, you are definitely eligible, and it is important to get that annual screening done. So that's just a bit about eligibility. Here we have our website, which is towerhealth.org/mobile-mammo. You can see here our event calendar for the upcoming month of January. So the events are not, they're a little bit sparse here in January, which we are expecting for the winter months of January and February, and then we will be picking back up come spring, come March, and we're hoping to fill those calendars and getting out into the community a lot more when we should be through all of the possible inclement weather that could be coming up here. So just a note, if interested in hosting an event with the Mobile Mammo Coach, we are scheduling out until the week of January 23rd at this time. So that would be the first available event date that we could still get on our calendar. It's not too late for that. So yep, so those are our upcoming events for 2023. Again, the website, towerhealth.org/mobile-mammo, there's a lot of really great information about the program on there. If there's anything that we might miss today or we don't have questions about, there's no questions about or we don't go over, feel free to check out the website and you should be able to find that information there. All right, so for appointment scheduling, so we do take care of all of the scheduling here at the hospital. Our central scheduling team, their phone number is 484-628-8611, and that's how you would call to get an appointment. We do have to have appointments scheduled ahead of time for these events. We do not do walk-ins. So when a patient calls to schedule, they should have their health insurance information readily available, as well as their primary care physician, who will be the ordering provider for their screening. So you will be asked for those two things when calling to schedule. So preventative screenings are covered under most insurance plans, but it's always important to definitely contact your health insurance carrier just to confirm that you will be covered for your screening on the coach. All right, a little bit about our patient financial assistance program. If patients do not have insurance, they are still able to get a screening mammogram. And all the statistics and all the data that Courtney had shared, these screenings are so important to women's health. And even if you do not have insurance, it's still important to go out and get the screening done. So we have the Reading Hospital's financial service representatives who work with our patients who are uninsured or underinsured to determine their eligibility for state medical assistance or other financial assistance. And they will help walk patients through those step-by-step processes on to determine their eligibility for those. And if a patient does not qualify for medical assistance, a partial payment and arranging a payment plan to meet the financial obligation for care will then be discussed. So as we say, the Reading Hospital's financial service representatives, they will walk them through that step-by-step to make sure they get the help that they need to make sure they still get these screening mammograms completed. Down below here is the Reading Hospital's patient financial assistance policy, which can be found online. There is a link there, but if you would like a hard copy of the policy, we can definitely provide those upon request. All right, so some mobile mammography data thus far. So we did launch mid-September. So we've been out in the community for about 2.5 months now. Well, going on 3 months, I guess. But so our goal is to do 200 events per year. As you can see so far, while we were getting up and running, we've had 27 events as of November 30th. We've done a couple more since then. And then as of November 30th as well, we had just shy of 200 screenings. So 199 completed screenings out of our hopeful 4,000 screenings per year. So definitely looking to hopefully get out in the community more now that we're up and running and smooth sailing, and to reach those fiscal year goals. All right, so a little bit about patient demographics based off of race and ethnicity. So on the left by race, we have seen 66.8% of our patients have been white or Caucasian so far, 15.6% have fallen under the other category, and 10.1% of Black or African American women. And then down below, a few other races you can see with lower percentages. And then on the right here, the count of patients by ethnicity. Patients who have not been Hispanic or Latino, we've seen 72.4%, and the Hispanic or Latino population, we've seen 22.6%. And then again, so based off of what Courtney had gone over and all of those statistics, we're really trying to hopefully these numbers that are lingering here down at the bottom, we're hoping to increase them and to hopefully raise those numbers. And as we got in the community more and into, like Courtney mentioned, those zip codes, those vulnerable populations, we're hoping to see more of these races and ethnicities who we have not seen yet by making this care more accessible to them. All right, and then percentage of patients by language. So for English-speaking patients, we've seen 83.9%, and then Spanish-speaking, we've seen 15.6%, and then Haitian Creole, 0.5% out of those 199 completed patients that we've seen so far. So again, language barriers can be an issue, cultural barriers. So we are hoping by bringing this mammogram coach out into the community and into those vulnerable populations and areas of need, that we can see more patient demographics with these other languages compared to what we're seeing so far. And then patient demographics by postal code. So Courtney had mentioned a few zip codes that were vulnerable populations, which are our 19604, 19605, 19606, 19607, and 19601. So you can see 19601 is the largest population that we've seen so far at 11.6% of our events. And then the others are about between 3.5% to 5.5% of our events that we've held thus far in those 27 events that we have spoken about previously. So again, really trying to get out into these zip codes, trying to reach those vulnerable populations and trying to meet them where they're at rather than facing those barriers such as transportation, childcare, time off work, things like that. So really just trying to get out into those zip codes and trying to be more convenient and more accessible for these women. All right, so our call to action, a couple of things here that we could use your help with would be, first and foremost, do not delay scheduling your annual mammogram screening. If you are a female within that age range, these screenings, like Courtney had mentioned, they are so important, and early detection truly does save lives. So the sooner that you're able to catch something, the sooner the more likely you will be to overcome it. So like Courtney had said, there's a 90% survival rate if you detect it early on rather than later. So definitely do not delay scheduling that annual mammogram screening. Also, talk to a loved one about the importance of completing an annual screening mammogram. Again, the holidays are coming up. We'll be around the tables with our friends, our family, our loved ones. Definitely talk to those you love about getting screened. And we're really just trying to raise that awareness and the importance of getting these screenings done. And then last, host a screening event at your business or other affiliated organization. So if you have the adequate space for us to park our large coach at your organization or business, we would love to be there. Pretty much all we would need from you would be parking for the coach, some help promoting the event, and then last would be just a restroom for these patients to use because we do not have any bathroom facilities on the coach. So pretty easy to host an event if you are willing and able we would love to hear from you. So for additional information and to schedule that mobile Mammo Coach event, I would be your contact. So my email address is listed here, which is ashley.gallen, Gallen, @towerhealth.org. And then my phone number is 484-628-2208. So I'd love to hear from each and every one of you. If you're able to host an event, we would love to be there. And then again, do not delay those annual mammogram screenings because they're so important to your health. And then here are just a few of our past and future event partners who we've worked with previously and we are already partnering with. So you can see here just some examples: Alvernia University, Customers Bank, Boss Cubs, Albright College, Herbine, Community Health and Dental Care, Berks Community Health Center, Centro Hispano. We are so thankful for each and every one of them and for them allowing us to park our coach at their locations to get women screened for these annual screenings. So again, thank you all so much to all of them, as well as future event partners who we're looking forward to meeting with soon.
Great. Well, thank you, team. It was very, very fascinating stuff. Tony, when we were getting ready to launch the session today, you had said it took about 2 years to bring all this together. Why? What were the obstacles? What were the challenges in doing that?
Yeah, so it's a great question, Dave. Another great statistic that Dr. Barbera gave during the ribbon cutting was when this coach was, the idea was first hatched. As it came to fruition, it took 17 different departments within the hospital to make this coach reality. So as you can imagine, if you were building any outpatient mobile or screening center for mammograms, anything that you would have to think about, whether it was IT or safety or the radiologist or the mammo techs, infectious disease, the list just goes on and on. The number of departments that need to be involved in creating a brick and mortar space, those same departments need to be heavily involved and thoughtful in creating this space that rolls around throughout the community. And the other thing I want to say that I wanted to mention that some of the mammo techs said on the coach, that they're actually hearing women say that they're feeling less stress in the coach getting their screening. They're not sure why it is. I don't know if it's a different setting because of the brick and mortar, but inside the coach, it's very peaceful. It's a very monotone, a lot of beige in there. It's very calming. And so I'm not sure what the reason is, but it was good to hear that actual patients say, I feel actual less stress getting my mammogram in this coach than I do sometimes at the regular setting. Maybe it's because there's a lot more privacy because really there's only one patient in there at a time, as opposed to, there is a lot of, there's some anxiety around any of us that have to sit in a waiting room with other folks. So just wanted to share that as well.
No, that's very helpful. It got to a couple of questions that I had. But so this is a real epitome of collaboration internally within the health system, collaboration with your funders. That was an impressive list of people that help support this. And this picture here with partners in the community you're working with, it really is a statement about collaboration to address a significant problem. Actually, you all use the phrase completion rate. What does that mean? Is it just getting the exam?
Yeah, so we, looking at our overall patients who we've seen so far, that is the completion rate would be those patients who we do see, like our brick and mortar locations, we unfortunately do see some no-shows and cancellations. So those completion rates are the patients who actually had shown up for their appointments and had completed their mammogram screening.
So completion is you show up for the examination. And
yeah.
So 50% completion rate is about half of the people who should be getting this or getting it. Is that fair to say?
Yes. Yep. So Courtney, I don't know if you want to speak to that a little bit more based off of the community health needs assessment and those completion rates.
Yeah, definitely. So, yeah, that 50% completion rate would mean that of those who are eligible to get the screening, they scheduled an appointment, showed up for their appointment, completed their appointment as documented in our EPIC electronic medical record. So for those, the difference, the other 50%, they might have scheduled and been a no-show. They may just have not scheduled at all. So there's a number of reasons as to why someone would be in that incomplete category, didn't complete their screening, but the actual completion of the screening will be based on the results in our EMR showing that a screening was done, images were taken, and a radiologist read the results.
So education is an important part of this process. We need to be focused on that a little more as well.
And this opportunity right here is a perfect example of us providing some community education. Getting the word out there about the importance and the availability of our screening coach.
So how long does a screen take?
I'm glad you asked that, Dave, because Tony brought me to that point when he was just speaking. I wanted to mention that. So these screenings on the mobile Mammo Coach are super quick. Our slogan is easy, quick, and convenient, and they only take 15 minutes. So a woman who may have face some of those barriers that Courtney had mentioned, if we come to her place of work, she can hop out of work for literally 20 minutes, I would say max. Her screening will take 15 minutes, and she can walk back in. So they're 15 minutes on the coach.
And to get the screen, you have to call for an appointment. Is that right? So the coach is coming to your area, you got to call to get an appointment to get in?
Yes, they do have to have an appointment scheduled ahead of time. Unfortunately, we cannot do walk-ins at this time because we do need that order from a provider put into the system ahead of time prior to their appointment.
Okay, so working with the people that you are hosting the coach is important to get them to get people to register for an appointment.
Yeah, so we do rely on the host sites to do the majority of the promoting of the event. We also promote on our end, though. We do put the dates on our website. We do make sure that these events are known about in the community. So the biggest ask for promoting from these sites would be to just pretty much put on social media, do email blasts, put it in your newsletters, just letting people know that we will be showing up on certain event dates. And then, yeah, so they will know then in all of our marketing materials that we provide these host sites with to promote their events, it tells them how to schedule. So it's a pretty easy process once they know that we'll be there.
Just piggybacking on that, we tried to improve our marketing and communications to make it a much lighter lift on our partner organizations. So we have social media graphics ready to go that you just add your logo, you add your event date, and you can post it on your social media. Ashley mentioned e-blasts. If you do client e-blast to your clients, if you do e-blast within your organization, if you have print or electronic newsletters, the content is already written up for you. You plug in your organization's name, you plug in the dates of your events. If you want to add anything else, a quote from someone within your organization about the importance of having a screening mammogram completed, it's all right there for you to copy and paste. So we want to make it as easy as possible for you to spread the word about this. So that's why we developed a great marketing package that will hopefully do that for you or your marketing team within your organization.
Okay, so we need to push this out to organizations so that they understand it's not a hard thing to do, but something they can take the lead on with their employees, with their customers, with their neighborhood, whatever. What kind of outreach are you doing to the potential host organizations?
Yeah, so pretty much right now, things like this, we're trying to just bring awareness to the community that we are out and about, that we are willing to go wherever we can with the coach. There is a 1 hour radius. I should state that we can go anywhere within a 1 hour from the Reading Hospital, as long as they have the adequate parking. So the outreach right now is me just making phone calls and sending emails, looking on websites, checking out their parking lots on Google Maps and seeing if it looks like they can fit the coach, and then just having those conversations to see if there's interest on their end. And then hopefully with these types of educational videos that we're making and outreaching to the community this way, we're hoping to have them call me and them reaching out and being interested in the program and wanting to help out these women within our community. So that's what we're doing so far.
Okay. And because you have to schedule the appointment, that probably determines the time and the length of time that you're going to be at a particular site. Is that correct?
So we do, the majority of our events, I will say, are Monday through Friday from 8 to 4. So we do specifically, we mostly do that range, except for on this screen here, Bayer Corporation, for instance, they have third shift employees, so they wanted to reach them. So we're doing a 6 a.m. to 2 p.m. Event for them. So we can hopefully, when those employers are coming off third shift, they can still be seen on the coach quick before they go home. So normally we do those Monday through Friday 8 to 4 events, but we also we have the capacity to do weekend events as long as we have the mammo techs and drivers available to do so. So definitely not opposed to doing those. And then again, if we need to reach a certain shift at your place of work, we can always alternate those hours as well.
So there is some flexibility in terms of time and scheduling. Who's physically on the coach when it shows up at a site?
Yeah, so normally it is our driver, and then we have our mammo techs. At some events, we'll have a registration individual helping do registration, but normally it would just be that driver and the mammo techs. These are very sensitive screenings, so we try to not have too many people on the coach, only the people that are needed to be there. So our driver is wonderful, as well as our mammo techs. They're the same mammo techs who work at our brick and mortar locations, such as Spring Ridge. So they are very highly trained and qualified, and they're all very friendly and great ladies. So yeah, so that's who a patient would find on the coach when they arrive for their appointment.
Okay, a couple questions that leads to. One, you said that you can get the screening, but you don't necessarily get the diagnosis. How do you go about getting, if there's a diagnosis, how do you go about getting that?
Yeah, so patients, again, our highly trained and qualified radiologists will give them their results within 30 days. Normally it will be sooner than that. If they have my chart, they can get those results actually pretty rapidly. But yeah, so our highly trained and qualified radiologists will provide them with those, the results of their screening. And if they need any further testing, they will help them to get that set up.
And is that done by mail? You said my chart, which I guess if you're a patient at the health system, that's helpful. You mentioned that there are language and perhaps technology challenges for some people. Is there ways around that for people who get screened?
Yeah, so it's actually all about patient preference. So in our EMR system that Courtney was discussing earlier, patients can pick how they want to be contacted, whether it be via phone, via MyChart, by paper mail. It's all about that patient's preference and how they would prefer to get their results. Courtney, correct me if I'm wrong, but I'm pretty sure that's how that works.
Yes. So I would say also, so we are required to send a letter to all patients who are screened, regardless of the results. But I would say for those who there was a finding on their imaging, they're likely to also receive a telephone communication. Someone would call and reach out to them prior to them receiving a letter within that 30-day time period. As for your question about language barriers and addressing those, we do have interpreting services available. I know particularly with Centro Hispano, they had one of their case managers, I believe, who were available at the coach the day of the screening event to be able to provide translation services. So, we don't want language to be a barrier, and we have options available, whether it be from the partner organization themselves or whether it be through the hospital and our staffed resources to be able to overcome those barriers.
So that's a challenge. You can have it addressed for the patient.
Definitely.
obviously you said the statistics show that transportation was a barrier, and obviously bringing the service to people is a way around that. Talk a little bit more about how that works. I mean, if there's a neighborhood, you've identified some census tracts that are particular problem areas. Is there a way to bust into those neighborhoods?
Sure. Yeah, I can. Yeah. So, we definitely know that having reliable transportation is a barrier. We know that, we do have a public transportation system in Berks County, but it may not provide access or convenient access for residents of our community to reach our brick and mortar locations. We know bus rides can be time consuming. They can take a large chunk of your day. So maybe for a 15-minute mammogram screening, it ends up being a 3 to 4 hour round trip, depending on the bus schedule, when you're able to get to your appointment, things like that. So definitely try to mitigate those types of challenges by bringing the coach out in the community, recognizing, the zip codes where we see higher frequency of transportation barriers, and identifying organizations within that community, as Ashley said, who have that parking. The availability of a larger parking space that can house the coach for the day. And then also, making sure that we're partnering with organizations in that area who can do that grassroots outreach to make sure that the residents in that community who have those transportation barriers, but also need to access these services, are aware of when the coach is coming, how they can get there, who they should call to schedule an appointment, to be able to get on our schedule for a screening. So definitely some targeted outreach and very intentional outreach on our end as to who we're working with in those areas where we see patients who are more vulnerable and more predisposed to having some of those barriers, access barriers.
You mentioned it, I think it was you, Courtney, you mentioned that it's, or maybe it was Ashley, an hour radius from the health system. What can you describe what that geography is? How far, what communities we're talking about that you go out to? It's obviously, is it all of Berks County?
Yeah, so I can speak to that. So it is, the majority obviously would fall within that Berks County area, but we also can go to other communities which are about an hour away, which via Schuylkill County, Montgomery County, Chester County, we can reach those as well. So definitely, I think the main focus, as Courtney shared a lot of statistics based off of Berks County specifically, we are hoping to reach a lot of the individuals within the Berks County area, but we can definitely reach those other communities as well if they are if they might be vulnerable populations, which we can do. We've been trying to do more research on the back end too with our radiology team on surrounding areas and what those rates of completion rates are looking like for their patients too. So definitely, as long as it's within that 1 hour radius, we are able to go to those locations.
And in the barriers to care, Courtney, I think you mentioned childcare as one. Is there some ability for people to bring their kids with them if they need to, or to have childcare taken care of?
So I don't know, this might be a question for Ashley as well. She is much more familiar with the coach, but yes, we certainly have staff who are available while childcare isn't necessarily promoted as an additional bonus of having our coach available. But there is a space where a child could certainly sit while their mother, parent, guardian is getting a screening completed.
One other question I had about some of the data that you presented showed a pretty significant increase between, I think it was 2019 and 2021 in terms of the number of people who would be eligible. Did something happen, or did you get better research in terms of who's out there?
Yeah, definitely. I think part of that, as we all know, COVID hit, And I think one of the reasons that we see some additional numbers there in the women who are eligible, obviously we have more women who are getting older, getting into that 40 plus population, so they're eligible for screening. Also, I think we see a greater gap there because a lot of people, especially at the start of COVID, were avoiding healthcare if they didn't feel they needed it. If they didn't feel sick, they were saying, I don't want to be in a healthcare facility. So I think we see some additional gaps during those years, particularly the start of the COVID pandemic, where people maybe weren't as focused on preventive care because they were so worried about what was going on outside of that and in their community. So I think that's one of the reasons why we see a shift in some of the data.
Yeah, good. So you're looking for community partners. If you're a business or a community organization, it's nice to see our colleges are responding to this, and some significant community organizations. Mm-hmm. They reach out to you, Ashley, and see about scheduling an event, and then you'll help them. Do you provide materials for them you said you have some marketing materials for them. Do you provide materials for them to give to their employees about why this is important?
Absolutely. Yep. So when we reach out to host sites, or if they reach out to us, we do provide them with patient brochure, flyers, things like that, which have, and our website obviously is on those materials as well, which provides a lot of great information for their employees to learn more about our program and the importance of early detection and these annual screening mammograms. So we, as soon as we start and we initiate those conversations, we provide them with materials, and then any questions that they might have, we jump on a call or we have phone calls, and we help them to better understand the program as a whole.
And then if they will reach out to their community and push them to come do this, you can see you're fairly flexible in terms of the time and days that you can get there. You know, some parameters around the work schedules of the people going to be on the coach, but you can be fairly flexible in terms of that. And you can see if that number of 15 minutes for the screen is correct, you could see a significant number of people in a 3 or 4 hour period in a particular employer or particular neighborhood. Is that fair to say?
Yeah, so we do, on average, we like to say that we can do about 15 to 20 screenings per event. So depending how far we're traveling to, if we're going somewhere on the verge of that 1 hour radius, we might be able to do a couple less screenings. If we're closer to home, we'll be able to do more because of less travel time. But on average, we can do about 15 to 20 screenings total per event.
Well, we just have a couple of seconds left here, I think, in terms of our time. What final message do you guys want to deliver? Tony, Ashley, Courtney, what's the final words you want to give to people?
Well, again, I would just like to thank everybody for their support of this, again, vital outreach to the women in our community. Please, if you're on this call, please reach out to your network and put them in touch with Ashley to sign up, not only to get screened individually, but most importantly to get as many community events scheduled as possible. And you know, we're just so thankful. And if you want to help further, we do have a mobile mammography patient assistance fund that people can donate to as well. So we're certainly always welcome to helping those that are most in need. So we're just thankful for the opportunity, and we just want to serve the community.
Had to let you do that commercial. Courtney, any last words you want to say?
Yeah, definitely. I think the first message is, if you are eligible for a screening mammogram, don't delay. Early detection is the best way to save lives. It's our first line of defense. A thank you to everybody who participated today. And I think one thing that I do want to share is, we talked a lot about promoting this at businesses and coming to your business and targeting your employees, but more than just businesses. And that's why we said affiliated organizations. If, you are a member of your local church, we can come on a Sunday to your congregation and meet your congregation in the parking lot and provide these services to them. You know, think outside the box. It doesn't just need to be a business that you're associated with. It could be a social group that you're involved with, or some other organization or group in the community. It doesn't necessarily need to be strictly employer-based events.
Great, thank you. And Ashley, most of this is falling on your shoulders, so I'll give you one last chance to talk about what you would like to say.
Yeah, so I think Tony and Courtney mostly summed it up for our final words, but we're so thankful first and foremost for everyone who's been involved in this program thus far and has helped to make this happen. We're so thankful for our community and especially the women within our community, and we really just want to make sure that we're making this care more easily accessible for women to increase those survival rates and to make sure that women are being screened on that annual basis and to make sure that they're in good health. So early detection saves lives, like Courtney had said. There's a really great breast cancer education video that can be found on our website that we did with a couple of breast cancer survivors, which really makes it hit home a bit more with them explaining their stories. So definitely check that out on our website or on our social media pages if you have the chance to do so. And definitely spread awareness to your loved ones and make sure that they're aware of the importance of these screenings as well.
Thank you all for this, I think, excellent presentation on a very, very important topic, very significant for our community. So thank you for that. And thank you for the work that you're doing here. We really appreciate that. We will be sending a copy of the video to everybody who registered for the event. As I said, we want to thank you for joining us today. This is our final spotlight program for calendar year 2022. So we'll see everybody in 2023 when we start this again. And hopefully this has some impact on the broader community. Thank you, everybody, for today. Appreciate it.
Thank you. Thank you, John.
Thank you so much for having us.
Thanks, everybody. Great presentation. Nice work.